So good evening everyone. Myself Dr. Seran Reddy, Academic Director and CEO of ADrPLEXUS. Today we are here to discuss about the synopsis of today afternoon's meeting on National Medical Commission addressed by the Chairman of NMC on the National Exit Examination, which is most awaited and probably for the one meeting like which the almost all the country of medical students all awaited. We are going to discuss about the salient features, what are the important points of the discussion, and also the insights and analysis of the 40 minutes presentation by the NMC chairman, Dr. Suresh Chandra Sharma. So he started by stating it is a sincere responsibility to address the students and remove the anxiety. So he is here to present that, and the differences between the conventional examination, he went NEET, and the upcoming NEXT examination. And he stated and he emphasized that their intentions are not to create a problem with this next examination, but to solve the problem. And he made sure that this examination will make the learning and the exam enjoyable, and next exam will be better than any other examination. And this webinar also addressed the to help in familiarizing with the type of questions. So he started by saying this, and he stated the advantages of this next examination will be the examination won't be focusing exclusively on the important topics. For example, like MI, CHF, he quoted these examples and he said like usually these examples will be passed on from these topics will be passed on from seniors to juniors every year, and there will be standard topics where you have to focus. So this selective reading has to be abolished, and they will be focusing on the generalized reading, and which helps in comprehension and understanding the subjects and learning to make learning more enjoyable rather than exam focused. And this examination will be focusing on to eliminate the chance factor, and also it helps in eliminating the favoritism and to bring impartiality. This is what he stated. And the advantages, as to consolidate, it is a uniform approach, and it not only prepares you to compete just at the national level, but also at the global level for the students who are preparing to appear for the examinations to prepare for USA, UK, Canada, and to make the learning and exam enjoyable. And he stated that next step 1 examination, the next step 1 will be comprehensive computer-based examination. This is the first important point, computer-based examination based on high-quality multiple-choice MCQs. He explained almost important points, ensuring objectivity and following nationwide delivery and conduction with robust fidelity in a secure manner. He said the examination will be uniform and impartial, and it will be conducted to make things uniform. The MCQ items would address higher domains of knowledge aligned to the competencies. It's mainly focused on, if you see next 1 examination focused on the knowledge components of the competencies, and next 2 examination explained the skill aspects expected of an Indian medical graduate or a graduate practicing modern system of medicine, especially in India. So here in this particular slide, what is displayed by the NMC, it is most important thing is the computer-based examination, and it will happen uniform, and it mainly focuses on the domains of the knowledge related to the competencies, which has been NMC CBME competencies which were given. And he also emphasized the aim of this is to improve the standard of the examination without stressing the student, and also discourage mugging up. He quoted examples like there's no point in mugging up the complications of narcoanalysis, cerebral cortex functions, etc. But to understand the point and applying that knowledge is very important. It's not just about the knowledge, but applying that knowledge is very important. And the key points, the examination, next 1 examination, in contrast to what they said last time, which will be conducted once a year, they said like it will be conducted twice a year, usually in the month of May and November, and they removed the word supplementary. Earlier, in the earlier guidelines where they said like the supplementary examination will be there after 1 month, but this has been removed the word supplementary. The student can wait for 6 months and they can take it later. And learning the skills in internship is very, very, very important, because that is what the next 2 addresses. Then the exam happens to emphasize twice a year. The supplementary word has been removed, and anyone who has passed the examination is equal. He emphasizes that point. And the examination, next 1 examination happens in the month of May and November. And while addressing, so he also gave some tips to answer the questions, like whenever you are in doubt, close the eyes and take deep breath, logical thinking, comprehend what is being asked in the question. Majority of the times, almost always, the clue will always be there in the question, and do not waste time in one question and keep moving forward. This is the tips to answer the questions given by Professor Dr. Suresh Chandra Sharma, sir, who is the professor, who is the chairman of NMC. And now the question, those who have already passed ENT and ophthalmology, as he's addressing the final year students, those students have already passed ENT and ophthalmology, and how will they have to take this examination? He mentioned that they can take it either simultaneously in the next examination along with the main examination, which is conducted with along with medicine surgery, or they can take after 6 months. And this option, he left it for the students, and the students can suit whatever suits them. And but this is only for this year, that is the current batch. And for those students who are in the next year, that is in the pre-final year now, they will be taking all this examination at one go. And now the most important question, what happens for those who have completed their MBBS? So this is like, he categorically mentioned it will be NEET exam for this year. While addressing, so he said that like I am here mainly to address the final year students. You don't have to bother about this, but yes, but yet he mentioned about a couple of points. And 2019 first year MBBS batch, I mean the ones who he addressed the final year students across the country, they will be the first batch to take admission to post graduation through the NEXT PG examination. So that means that there will be NEET examination for this year, and for the next year probably yes. So for this year there will be NEET examination and also the next examination. So NEXT-1 examination will be for final year part 1 students, final year part 2 students, and the NEET examination for those who have completed their MBBS. He very specifically mentioned 2019 first year MBBS students will be the first batch to take admission into PG through the NEXT. That means for whom he addressed today, who are all the final year students across the country. And he also mentioned we'll think about the equivalence later, and didn't explain clearly on the future course, and mentioned this address is mainly for the final year students. He specifically mentioned, emphasized it twice. Then how about the next step 1 examination, the distribution of items and knowledge of questions? See, they mentioned to ensure assessment of higher domains of medical learning, a majority of items shall test higher level of comprehension, analytical skills, clinical problem solving that are aligned to the competencies. They insist on the word competencies, and you see this comprehension, analytical skills, clinical problem skills. These will be again reflected on the split of this, where 30% of the questions will be comprehension, and the analytical and clinical problem skills will be 60%, and 10% will be the recall. Similarly, we'll do this. And next step 1 format is intended to discourage rote learning and mugging by the medical students. He emphasized that point again and again. And case vignettes and clinical scenarios shall be overwhelming pattern of examination. And as I said, like the distribution of items and knowledge level of questions, the problem solving and analytical skill type questions, 60 to 70%. When he explained about problem solving and analytical skill types, he mentioned like a particular scenario will be given where they may ask about what is the next investigation and what is the next lab investigation or radiological investigation needed, or they might, what is the next step, what you will do in the hospital. That is sort of questions. And comprehension type, picking up the clues from the question, and the knowledge, what you know, applying that knowledge. And then recall type of questions will be 5 to 15%. They said like they'll try to keep it as minimal as possible. And competencies acquisition and the level of knowledge the questions asked. Must know questions will be 60%, nice to know questions will be 30%, and may know questions will be 10%. He explained in very detail what is the need to put it in this format. Must know questions are what any Indian medical graduate should be knowing, so that he is fit to practice in a government or corporate setup, and like he's deemed to be a doctor to get a recognition. Those are the must know topics, one should know that. And he said if someone can master this must know, they can still pass this examination. And nice to know is the 30%, where it will be like more of comprehension and understanding and applying that knowledge. And may know is like 10%, which will help to filter. There will be slightly unusual questions, and this will help to filter out the top 10 to 15% of the merit for the postgraduate entrance examinations. This is what had he explained in detail, like what is the relevance and what is the importance of when this sort of questions and why this particular percentages were given. And most important, the papers and distribution of subjects. The next step 1 examination will have 6 subject papers with respective weightage and items and time allocation. You see applied aspects of all other subjects of MBBS, including FMT and community medicine, that includes anatomy, physiology, biochemistry, pathology, pharmacology, microbiology, forensic medicine and toxicology, and SPM. These 8 subjects will be mainstreamed into the relevant clinical subjects. In each paper, 10% of items will be pertain to applied aspects of the related subjects. So the following table 1 provides the subjects in each paper with respective weightage and items and time allocated. If you see here, medicine and allied subjects. When they say medicine and allied subjects, it includes psychiatry, dermatology, and radiology. So medicine, psychiatry, dermatology, radiology, the total number of questions will be 120 and the duration will be 3 hours. Surgery and allied subjects like anesthesia and orthopedics, 120 questions, 3 hours. Obstetrics and gynecology, 120 questions in 3 hours. Pediatrics, ENT, ophthalmology, 60 questions each, 1.5 hours duration. So the most important here is, if you see the pattern, obstetrics and gynecology is going to be the single most important subject with 120 questions. And the major subjects, the examination will be conducted in the morning, and the minor subjects, the exam will be conducted in the afternoon. They also mentioned, he quoted like few examples, like when I mentioned about the allied subjects, how these questions can be related, and how these questions can be related with the applied subject. These are the few examples quoted by the Professor Suresh Chandra Sharma. So it is the types of pneumonias, whether it be nosocomial infections or hospital-acquired pneumonias, and when it is injury to the right side of the flank with pain abdomen, the type of injuries. Then a patient come with a head injury or simultaneous with the fracture of limbs, like integrating the surgery with orthopedics. Then hypertension with the headache, what will be the diagnosis? These are few examples quoted by him in his presentation. And this next step 1 proposed time schedule of papers. So if you see this, the medicine and allied subjects, that is psychiatry, dermatology, radiology, the examination will be 3 hours, so break will be 2 hours, followed by pediatrics, 1.5 hours of examination. And the second day it will be rest day, there will be no examination. Second day and the third day there will be surgery and allied subjects, that is anesthesia and orthopedics. The duration will be 3 hours, a break of 2 hours, and ENT for 1.5 hours. Then fourth day there won't be any examination, and fifth day obstetrics and gynecology in the morning, 3 hours duration with a break of 2 hours, and ophthalmology 1.5 hours. So tentatively we assume the examination may happen from morning 9:30 a.m. to 12:30 p.m. and with 2 hours break from 12:30 to 2:30, and the examination, the afternoon examination will be 2:30 to 4:30. Sorry, 2:30 to 4 p.m. So if you see this, the NEET examinations, what we do, or the INSET examinations, in 3 hours you will attempt usually 200 questions, and here in this 3 hours you are attempting 120 questions. So you have 180 minutes to answer 120 questions. So he emphasized the fact that we are here to help the students, and also that itself, the timing of 180 minutes for 120 questions, that is like approximately 1.5 minutes for each question. That itself implies the questions are going to be lengthier, comprehensive, and where you have to, it's not, as they already mentioned, the recall questions are going to be 5 to 15%. So it's more of comprehension and problem solving. Be prepared for that. And because each and every question you are going to get like 1.5 minutes of the time, like, which is very unusual in the recent past in the examinations, particularly when it comes to the Indian examinations. So, and also he explained about what to do, what are the do's and don'ts on the rest day. Those rest days, he mentioned that those are not for reading and not to revise, but to refresh and relax, and good night's sleep is very important, and don't read anything in the morning and keep on changing. If you keep on changing pages, it will get stressed. And he explained about his experiences and his MS examination. He was from PG Chandigarh, and how he was playing caroms before the day of his MS examination. This is what he explained. And then coming to the next step 2 examination, the main objective of this is, it will be comprehensive practical or clinical examination to be conducted after completion of internship that evaluated competencies. See here, very clearly they mentioned competencies in clinical diagnosis, patient examination, clinical decision making, practical and communication skills necessary for practice of modern system of medicine. So here mainly from the competencies, the skills component is mainly tested. In the next step 1, the knowledge part, and step 2, the skills component is being mainly focused on. And evaluation methods, how do, here in the next step 1 examination, it will be mostly on multiple choice question examinations. Here it will be in evaluation methods. Each examination would comprise of actual cases, objective structured clinical examination OSCEs, simulations if possible. He mentioned like in your simulation labs, it might be like intubations, etc. And that is like which will help you to save a patient or to treat a patient well. And depend on the ability of satisfactory or unsatisfactory performance, there will be only 2 levels of grading. Either it may competent pass or competent or pass, or non-competent or fail. Only two gradings. There is no scoring system here. Only pass or fail will be there. Here it is again, they emphasized that the purpose of this is whether the graduate who are coming out of during the internship, in the internship they have to focus on clinical learning also, and it is very important, and they should be a safe doctor, which the country, when they get a registration, he should be a safe and efficient doctor. That is what they mentioned. So the purpose here is only to assess whether they are competent or not competent. And distribution of subjects, again same, medicine and allied subjects, surgery and allied subjects, obstetrics and gynecology, pediatrics, otorhinolaryngology, ENT and ophthalmology. In addition, they added about orthopedics and physical medicine and rehabilitation. Well, while explaining the importance of orthopedics and PMR in this context, particularly in the NExT-2, he quoted two examples, like particularly when if a mother comes with a child crying with a pain, and it might be, if you have to know that lifting child with one hand dislocation, and how to handle accidents and trauma. These are the things he quoted the examples. Then next step to the time schedule. The time schedules and modalities of next step 2 shall be decided by the National Medical Commission and the respective authorized authorities and institutions after completion of internship and prior to admission of postgraduate courses of the final year. And they had given a tentative schedule for this also. So here, if you see this event, next step 1 examination happens twice a year, May and November, and date of results usually will be in the first week of June or first week of December. And the university examinations usually happen in first week of June after this, or first week of June or December. Then internship will commence from 1st January or 1st July, depending upon the students who cleared. It will happen in cycle. And then next step 2 regular will be in 3rd week of June or December, as again similarly. Then next 2 supplementary, if someone didn't clear, it happens after 3 months. Here there is no supplementary for next step 1, and they have removed that word. For the next step 2 they are conducting a supplementary. And postgraduate admissions usually happen in May to June, and the seats which are left, and they'll be combined with, there shall be again a counseling with the month of December for the seats which remain for the vacant after earlier counseling held in May or June. So usually the postgraduate courses, they are targeting to commence from 1st July or first week of January. This is what the tentative schedule which has been given. And conduction of mock test. Today is January 27th of 2023, and the registration will start from 28th, and the mock examination will be conducted exactly 1 month after this, 28th July. And this only the final year MBBS students pursuing MBBS courses in the medical colleges or the institutes are eligible for this examination. And the examination will be conducted by AIIMS Delhi as a designated authority for the next step 1. This is one more clarity they had given. And the aim of such test is to familiarize the prospective candidates with the computer-based test, software interface and process flow in the examination center. They mentioned this exam will only exemplify pattern and format of next step 1 examinations. They don't represent the complete next one, because they're probably conducting a day, and the actual examination runs over 3 days. And the disclaimer they mentioned, the complete detail of next examination is being notified through regulation separately. So any contained and spoken in this presentation will be superseded by such regulation, is what they had mentioned. And while doing so, he mentioned that the examination will be conducted by AIIMS Delhi. At the same time, he was asking his colleagues like whether the AIIMS has released the notification, and they were saying they are in the process. So probably by tonight or tomorrow morning we can expect the regulations and the link for the registration for the mock examination also in the AIIMS website. And one very, very, very important thing is about, he used the word one complete cycle. What is mentioned by this one complete cycle? If you see this, one complete cycle means the 6 examinations, all the 6 papers. So if someone had taken the examination on for 4 the scores of the complete step 1 exam, all the 6 subjects. Suppose in 1 year they had taken an examination where they had scored some X marks in medicine and in surgery, and they got more marks in medicine and surgery in the next examination, but less marks in pediatrics or otorhinolaryngology. So they can't club both. So if you want to take it, all the 6 examinations marks will be taken completely. That is what he mentioned by like one complete cycle. So if a person gets in medicine, surgery and obstetrics, gynecology, cumulatively if they get suppose cumulative level of 360, some 312, and in the next examination he got it more marks. So it is like he can't take, I'll take 3 subjects from this examination and 3 subjects from this examination. So all from the complete cycle, that means all the 6 papers, the cumulative score is what is being taken. This is one more clarity they had given. And now after this webinar, what are the questions answered? The exam pattern they had given about this, and the schedule, the syllabus, The scoring pattern and the designated authority to conduct the next one examination will be the All India Institute of Medical Sciences. And what are the, whether this answered all the questions? No. What are the questions unanswered? There's no detailed clarity for those who completed MBBS students. What happens from next year? Probably we hope that they'll give more guidelines regarding this in the near future, though he mentioned that other queries will be answered in due course and the regulations will be released. That is what he mentioned at the start of the presentation. So this is what we'll expect from this. But one thing is for sure, this year there will be NEET examination, or also the next one. NEET will be for those who completed their MBBS, and next will be for those who are in their final year, part 2. And earlier they mentioned they'll take the 3 examinations average score, and though he mentioned about 1 complete cycle here, he didn't use the word regarding 3 exams anywhere. So whether it's been removed or being continued, there's no clarity. But what we can infer from today's presentation is probably they might have eliminated this 3 exams average score, and they can take from all the 6 examinations average in that particular cycle, 1 complete cycle of 6 examinations. It's not like you can't take it 2 from that examination and 4 from this examination. And this, unfortunately, they didn't give more clarity and any clarity on the foreign medical graduates. These are the questions answered and unanswered. So this is the brief synopsis of today's address by the National Medical Council Chairman, Professor Dr. Suresh Chandra Sharma sir, for all the final year students across the country, all the medical graduates. Now you are free to shoot out your questions where I can answer based on your questions. Rohan, your question, last time NEET-PG, probably, and it might, when he mentioned that we will discuss about the equivalence later, when he used that word, like probably they didn't mention about what happens to the next year. And he also mentions the present batch will be the first batch who will be taking admission through the NEXT-PG examination. So based on that, like what will happen for the next year, 2025? This means like as they are conducting the examination twice in a year, how it happens, we have to wait and see. Please feel free to shoot out your questions. So what about FMGs, those who will pass out this year in July? They have to give FMG or next this year. So Dr. Fluffy, unfortunately, in this presentation, he didn't mention about anything about the foreign medical graduates. So we assume this FMG examination will be there and NEET will be there for you for this year, and from the next year, it's going to be through the next examination, next one examination. The PG counseling and NEXT-2 are clashing. Yes, because they are keeping that window, like which happens after those who have, because the NEXT-2 examination, the PG counseling and NEXT-2 examination, PG counseling happens on your NEXT-1 scores, and the NEXT-2 scores is only pass or fail. Then, so for us, we have NEET-PG and the exam date is yet to be cleared. Plus, sir, is there any change in the INSET pattern? Yes, for those who have already completed MBBS, there will be NEET for this year, according to what Professor of NMC, the chairman of NMC had said. Is there any change in INSET pattern? INSET pattern, he didn't mention about that. INSET examination, at least for this year, it's going to be the same pattern. Then, what about students who are ID by any chance had to give NEXT-2 supplementary? Just because of that, they'll not be allowed to join the PG. Yes. So in this scenario, suppose you have cleared your NEXT-1 examination, you have got very good score, but unfortunately, if you don't clear your NEXT-2 examination, so you will be having supplementary in the next 3 months for the NEXT-2, and then you will be going into the next cycle. That is after 6 months, whatever counseling is there, you have to go for this. So despite so NEXT-2 clearing is also important. Even you might be the All India first in the next PG1 examination, but you can get entry into the postgraduate entrance. You can walk in the corridors of as a postgraduate in medical colleges only after clearing your NEXT-2 examination. And though it's just pass or fail, it is very important to clear this examination. So focusing on the clinical skills in the internship is very, very, very important and paramount. And he also mentioned they'll be assessing on the clinical competencies, particularly based on the skill based. Then what about the student? Okay, then. Any more questions? Okay, guys, all the very best. And as I said, like ADrPLEXUS are the pioneers of this NExT training, both 1 and 2, and we are always there to help you, and we are there to help you in synapsing for your success. And all the very best. Seeing forward for further examinations. All the very best.